Hello, everyone, and welcome back to This Week in Global Health, otherwise known as TWIG. This week, we're going to be talking about maternal health. That's kind of in honor of Mother's Day and the fact that it was International Maternal Health and Rights Day on April the 11th, and I think International Day of Midwives on May the 5th. So this is the season to be talking about women's rights, maternal health. My name's Greg Martin. I'm going to ask the panel members quickly to introduce themselves and tell you about what it is that they're going to talk about tonight.
Hi everybody, I'm Chris Ronson, coming to you from San Francisco, California, and I'm going to be talking to you about disrespectful and abusive care in the context of respectful maternity care.
Hey everyone, I'm Jessica Tapp. I'm coming to you from the Washington, D.C. metro area. Tonight, or today, depending when you're watching, I'll be giving you a science and research update on this topic, and I'll also be giving you some background and talking about the organizations that are involved in this field.
Hey everyone, my name is Katie Jackson. I'm coming to you from Stockholm, Sweden. I'm going to give you some background on the statistics of maternal health as well as the regular Katie's Career Corner.
Hi everybody, this is Sulzan and I'm speaking to you from North Carolina. I will be talking about the burden of maternal death in Nigeria and also how private sector can play a role by incorporating midwives to deliver healthcare.
Hi, I'm Sarah Weber. I'm coming from Washington, D.C., and I'll be speaking about what respectful maternal care is and what it promotes.
Hi, everybody. I'm Brian Simpson with Global Health Now at the Johns Hopkins Bloomberg School of Public Health, and I'll be bringing a couple of the latest news updates to you.
Okay, and that is the team. Thanks, everybody. Well, as always, we're going to start the show off with a news roundup, and that's coming to us from Johns Hopkins, from Global Health Now. Brian Simpson, we love your news updates, so hit us. What's been happening in the world of global health this week?
Sure. Well, I have to say all of our minds has been the last week and the protests and unrest after Freddie Gray's death. So we're highlighting today a news story from NPR it was really focused on Dr. Leanna Wen, who's the Baltimore City Health Commissioner. And one thing a lot of people didn't think about during the protests and after the riots, and including the looting of actually a dozen pharmacies, is just simple access to medicines, medications. There've been the Baltimore City Health Commission heard reports of people who didn't have their inhalers or were not being able to access critical medications like heart medications, insulin, and other things. And so the city actually set up a hotline that people could call into, and also because the public health information wasn't getting out enough, they actually enlisted student volunteers to go door to door in the affected areas of Baltimore to help get that essential medications out to people. So,
okay, that's really interesting. I mean, it reminds me of the fact that, whenever there's a shock, whether it's an extreme weather event, whether it's conflict, whether it's some sort of a city event, whenever there's a shock to a community, there are always vulnerable communities who land up paying the price because they either can't access their medicines or for whatever reason. It's usually the old, the young, the immunosuppressed, the misfortunate, etc. So this is another example of sort of unforeseen consequences. Thanks, Brian. And Brian, I believe you've got one more news update for us.
I do, and this is from reproductiverights.org, reporting on the UN Committee on the Elimination of Discrimination Against Women, finding that the Filipino government is violating reproductive rights and discriminating against women by making it difficult for thousands of women to access
Okay, I don't know if other people have had the problem. Brian's frozen on my screen.
Yeah.
Okay, Brian's frozen. We're going to carry on without Brian for now, and if he comes back onto the show, we can finish that news item. So if you're watching the show live, sorry about that. If you're not watching the show live, that's once again proof that this is an unedited show.
There it is.
It's all going live to an audience. All right, we're going to jump right in with Jessica's science update and an article that she's going to send us about maternal and child health. Jessica, over to you.
Okay, well, I think Brian's coming in and out, so hopefully that won't be too weird. But yeah, so your weekly science and research update. And in line with our theme today, there was a study that was just published in PLOS One that looked at the prevalence of disrespect and abuse during childbirth in Kenya. And the overall prevalence among 641 surveyed women found that, and this is 641 women in 13 facilities, there was found to be an overall prevalence of 20%. This means that 1 out of 5 women have experienced feeling humiliated during labor and delivery, and it includes everything from non-confidential care, non-dignified care, neglect or abandonment, non-consensual care, physical abuse, and also detainment for non-payment of fees. Now, this is a really interesting study because it just shows how prevalent this behavior is and how women are being mistreated or not respected during childbirth. And I want to point out that these numbers actually may be underestimates because the high prevalence, like 20% of these women, actually may contribute to this normalization of this feeling of this behavior, and therefore women may not actually see it as inappropriate or disrespectful. It actually may be just something that they say is normal, so they're not reporting it in the study.
I think that's a really good point, Jessica, because there's a lot of things that are just widely accepted as being a part of a culture, or if it's a more repressed community or something like that, women might not think that anything's going on, or if they do realize that something's going on, they don't feel like they're allowed to speak out about it because it is so commonplace. So it's very important to highlight that. That's a really great research piece.
Yeah, and I think, added to that, when we talk about maternal death and maternal mortality, we often talk about 3 delays. The first delay is when there's some sort of complication in childbirth. There's a delay in terms of not just woman making, but the family, because often the woman isn't empowered to make the decision, but that decision getting made to access healthcare or go to the hospital, and then there's a delay in terms of them actually getting to the hospital because there might not be a road, and then there's often a delay in terms of them getting treatment once they've arrived at the hospital. But it's that first delay that I think is often impacted by bad experiences with the healthcare services. So if a person has been in the service and been treated with disrespect, the next time they're pregnant, the next time they're in labor, the next time there's a complication, there may be a delay in terms of taking that decision to get to the hospital because of a bad experience in the past, and because of basically the health services not really treating them with the respect that they deserve. So I think that's tremendously important. Yeah. Thanks very much, Jessica. That was really interesting. I'm going to ask Jessica and Katie just to give us a little bit of background, some facts and figures. That's maternal and child health. What are the numbers? How bad is the problem? Talk to us.
Right. Okay. So as you know, it is a really big problem, and 280,000 women die per year from complications during childbirth. And another stat is 800 women per day die per day due to largely preventable complications during pregnancy or childbirth. So both are complications. MDG 5, the Millennium Development Goals, called for a reduction of every country's maternal mortality by 2015. They wanted a reduction by 75%, and it's widely understood that we have not met this goal.
And it's important to point out that the Millennium Development Goals are ending this year. So now we're looking forward into the Sustainable Development Goals, and they're also concentrating on reducing maternal mortality by 2030. And here they're setting the global maternal mortality ratio target to less than 70 per 100,000 live births, making this a specific maternal mortality indicator. And so what this means is that they are setting the goal that no country should have a maternal mortality rate greater than 140 per 100,000 population.
Right. And the thing is, they can set those goals because we know that it's doable. Most of the causes of maternal death are absolutely preventable. We know how to prevent them. We know what needs to be done, and it's just a matter of putting things in place and making sure that women have access to the right kind of facilities. Sorry, I interrupted you, Susan. I think you were going to jump in with a comment.
Yeah, no problem. Greg, at all. So just to kind of mention while we're talking here, I was reading the other day that every year nearly 3 million babies are stillborn, and these are lives that can be saved if every birth was attended by a trained midwife. This is why, in order to not only for maternal health but also for the future generations, it's really important to focus not only on the mother but also the health delivery. So just kind of wanted to point that.
Absolutely. Right. Now, I'm going to ask Sarah to jump right in here and talk to us about this idea of respectful maternal care. It's a term that a lot of people won't be familiar with. Sarah, could you just tell us a little bit about what is that? What does it mean, and what does it mean for us in working in public health and in the healthcare in healthcare?
Hi, Craig. Thank you. Yes, so respectful maternal care, it might not be an issue that, or a term that people are familiar with outside the maternal health space, but it's really an approach that focuses on the interpersonalization aspect of maternity care. It emphasizes the fundamental human rights of the mother, the newborn, and the family. And it also recognizes that all women of childbearing age deserve and need respectful care and protection of women's rights.
Along that line, one of the big contributing factors to respectful maternal care is something that we're going to refer to as D&A, which is disrespectful and abusive care. It's something Jessica highlighted briefly when she was talking through the science article, but it's a major problem in respect to respectful maternal care, and it's a top reason that women cite for not seeking care from a skilled health care professional. Also something that Greg had mentioned when we were talking about sort of setting that negative precedent. And it includes physical abuse, non-consented care, non-confidential care, non-dignified care, and description that's actually based on specific attributes, abandonment or denial of care. And there's going to be a number of articles that we provide to you in our show notes and on our website that highlight really specific examples of these. A lot of them are incredibly disheartening, and I think things that people don't associate with provision of care in general.
So, like, all of this is pretty familiar to me, I can understand what the terms mean, but I'm not a mom. I've never given birth. I don't even have like a sister or been there, and I just, and as far as I know, if all my friends have done it, it seems a normal thing. So it's really hard for me to conceptualize, and I'm sure probably a lot of our viewers are having that same problem. And so like, Chris, you were talking about these examples, and it sounds like I would love to hear a story or an example. Do you or Sarah have like something that really kind of just demonstrates something that, what these women are going through, and not just like, okay, not consensual care, but like an actual example?
Well, I could give you an example, yeah. Jessica.
That would be great.
I remember when I was a medical student, we had to work in obstetrics, and part of our training is we had to deliver a certain number of babies. And I remember working in a hospital, watching a mother giving birth, and watching one of the staff threaten to give her an episiotomy if she didn't push harder. Cool. But I mean, and this was done in such a disrespectful way. It was literally like holding up the scissors and shouting at the mother, "Push, or I'm going to cut you." I mean, it was absolutely disgusting.
Cool. Okay, that's a really good example. Absolutely horrible, but like that's exactly what I wanted to hear, because I could not fathom something like that happening ever.
Yeah.
Yeah, and let me tell you what. That what I'm describing to you was not an unusual. I mean, that didn't stand out as completely bizarre in that environment. We saw a lot of absolutely disrespectful behavior toward mothers who were in labor. And I can imagine those mothers dreading the thought of coming back into that environment and giving birth. So, I mean, I don't know if that helps give a bit of context to this discussion.
It really does.
It also happens not even just in developing countries, but in the U.S. and other developed nations, where women get kind of pushed into having cesareans when they don't want to. Brazil has the highest rate of cesareans. Other countries have a high rate. Usually it peaks around 5 a.m. and 10 a.m. So it's kind of 5 p.m. and 10 p.m. So when doctors and nurses are wanting to get home, they kind of put more pressure on women sometimes to have cesareans.
Actually, Sarah, just to mention, which another country which has a really high rate of cesarean operations? Rwanda. Rwanda, which has progressed so much in healthcare, but now it's just seen that cesarean is the easier option, and a lot of people just opt for cesarean. And I think somebody was telling me the number is like 80% of deliveries in Rwanda are cesarean. So yeah, just kind of putting that out, that it's a very interesting phenomenon.
Yeah. And I don't have any specific data. I've just heard through like research and things like that in different examples that cesarean births they're so unnecessary in many contexts. And just like you guys had all said, this is something that people keep going ahead with because of ease, or in a lot of situations because the physician gets paid more for delivering cesarean. So they actually sort of impose their will. It isn't just the getting home so much as it is that there's a monetary aspect to it. So, I mean, that's something that definitely needs to be on everyone's radar.
And some of the time, it's not just about the physician being paid more, because some of the time it's in a public hospital, right? So you might have a trainee, a registrar who's training to become an obstetrician, and he's on call that night, and it's 11 o'clock at night, and there's a mother that's in labor. And this registrar is thinking to himself, look, if this is a natural labor, this baby's going to pop out at 3 in the morning. Or I could do a C-section now, 11 o'clock, be in bed by 12 and get a decent night's sleep. And so you wouldn't believe in public hospitals how many C-sections get done between 10 and 12 at night, and how quiet the labor wards suddenly become between 1 o'clock and 6 o'clock in the morning. And so there's like non-financial incentives for C-sections happening all over the place. I hope my friends that are obstetricians aren't going to email me with paper.
Yeah, and even despite those statistics about getting cesarean sections and being forced to do so, when women choose to have birth outside of a birthing or health facility, the fears of being treated, because of fears of being poorly treated, their chances of having a clean and safe birth are drastically reduced, and the health comes of both the mother and the baby are quite threatened. So despite all of these things happening within a health facility, it's much better to be within a health facility for the health of yourself and the child than to be outside.
Yeah.
Absolutely, absolutely. Now, Sarah, would you perhaps just take the conversation and focus us in a little bit on this idea of respectful maternal care, and tell us, what is the promotion of respectful maternal care? What does that entail? What does that involve?
Well, respectful maternal care, it really promotes the respect for beliefs, traditions, and cultures, and it empowers women and their families to be active participants in the process. And so this can be anything from making sure that they've got right to information and privacy. They can choose a companion to be in there with labor and birth. They have the freedom to walk around or move during labor. It also involves good communication between the client and provider, prevention of disrespect and abuse. So there's a lot of things that entails, but just basically making the women, providing that focus more holistically on them rather than looking at the labor and delivery strictly in a medical term.
Okay, interesting stuff. I'm wondering, and perhaps Sarah, you can jump in again, who's doing what in this area? Like what organizations, who's involved? Who are the stakeholders here?
Well, there's really a lot, but I wanted to speak first of all just about the role of midwives and what they play, given the fact that it was just International Day for Midwives. And they play a large role in helping women deliver safely, and they've been instrumental in helping decrease the deaths of women and babies during delivery. But it's not all. Not everybody has the same access. There's a lot of inequality globally, and sub-Saharan Africa has a large inequality.
Wow, that's quite interesting. And when you talk about sub-Saharan Africa, we cannot ignore one of the biggest countries in sub-Saharan Africa, Nigeria, which is one of the leading countries, sadly, in terms of maternal mortality. So I was reading this the other day, the statistic that in Nigeria, only 14% of women give birth alone. Only 40% give with a skilled birth attendant, and that is the reason that Nigeria has a really high rate of maternal death worldwide. In fact, I was reading an estimated 53,000 women and 250,000 newborn die annually in Nigeria because of preventable causes, and a lot of it could be avoided with midwives who not only deliver babies, but are also really key resource when it comes to taking care of children and in terms of preventable diseases for children.
Yeah.
So,
and we've mentioned multiple times that midwives, especially, as they're some of the most important community health workers, and they're some of the most trusted people within the community, because they're involved in the pre-care, then during the pregnancy, and then post-pregnancy care. And there was a statistic that I saw that actually said that in order to meet the needs of mothers globally for both pre-pregnancy, pregnancy, and post-pregnancy care, we need a minimum of at least 350,000 skilled midwives, trained and ready to go into obstetrics and help out in hospitals or just in the field.
Wow, that's interesting, Chris. Very quickly, talking about Nigeria, I would be amiss if I don't mention Saving 1 Million Lives, which is an initiative with Clinton Health, initiative in Nigeria to save 1 million lives by incorporating midwives into roles and to kind of prevent maternal death. So that's a program, the details of which would be there on our page. So yeah, please have a look. Saving 1 million lives.
No. Oh, Sarah, was there something else? I was going to say there was something else that we had sort of talked about before the show, and
Yeah,
there's a document that's come out that you wanted
right.
to mention.
Right. So I wanted to share with everyone that the WHO put out a statement on prevention and elimination of disrespect and abuse during childbirth. This was put out last September, and it really illustrates a commitment to promoting the rights of women and access to safe, timely, respectful care during childbirth. So it's a big deal.
And among that, I took a look at the paper itself, and it's 4 pages, and I think the last page of it is, cited research. It's got a huge list of organizations that are a part of this agreement, and it highlights a lot of really important facts, sort of strategizing, but also mentioning that it isn't just women, that there's neglected populations within the female population, within these mothers who need respectful care, and that is younger mothers, almost in sometimes some cases adolescents, unmarried women, women of low socioeconomic status, women from ethnic minorities, migrants, women living with HIV. These are all people who are even more susceptible within that subgroup of experiencing the disrespectful care, or abuse.
Chris, that's really important to point out, and since you kind of mentioned like who's doing what and what organizations are involved, one organization that I was thinking of is the Change Center for Health and Gender Equality, and this is an organization kind of like what you were saying in terms of who really needs to have the advocacy for them. This is an organization that does advocacy for maternal rights, and they specifically are looking and trying to promote that women and girls have access to comprehensive maternal health care. And comprehensive maternal health care includes everything from family planning, essential medicines, skilled, rights-based, and respectful maternity care, as we've been talking about, but also things like HIV services, which include prevention and treatment, and something you may not even think about, also having safe voluntary abortion services. So that the organization is all about advocating for those things.
Yeah.
That's so interesting, Jess. But coming back to Chris's point, as women who are at risk of disrespectful maternal care, or rather lack of any maternal care, I was reading only 1 in 3 rural women in developing areas receive necessary care. And that's really important because these women in rural areas or remote districts and smaller health facilities in particularly suffer from a lack of midwives, and that's also like a really big problem that developing countries face. But coming back to the organizations involved, USAID has a health policy project which provides leadership to facilitate joint strategy development and action among a growing multi-sector community. Now, this project is really interesting because it focuses on advocacy to set the standard for respectful maternity care, along with community mobilization and information dissemination to promote social accountability. So that's another project definitely to take note of.
Yeah, and just really quickly to say that was another point that was highlighted in the WHO document that Sarah described, in that they were talking about how it isn't just all of these external actors that need to be a part of it, but it needs to be implemented within like a health system. Like it needs to be something that comes from the government, and it needs to mobilize the community as well as like the entire hierarchy behind the healthcare system.
Yeah, absolutely, Chris. And in fact, when you mentioned the other partners that can play a role here, so Indonesia is another country which has a high maternal mortality rate, and it has so many islands that there are a lot of areas which are remote. So one of the partners that can play a major role in delivering healthcare, especially through midwives, is the private sector. And an example of this is a program which was run by DKT. It's called the Andalan program, that was started in Indonesia, and it basically works on a franchise basis. So midwives are offered sales contract for offering contraceptives to women who come in care, and giving them kind of like helpful advice on what contraceptives to use, and so they are offered a sales contract and they receive 5% cash back. And what this franchising scheme offers is very interesting because it led to much lower number of underage deliveries in Indonesia. So that's something, that's, oh my God, what's happening with me today? So that's a way private sector can play a role in delivering healthcare, especially maternal care and advice for reproductive care in combination with midwives, especially in areas really far.
Well, if you've been watching this, we've made reference to a lot of web pages and different places on the web. We're going to have links to all of those web pages in our show notes. Those show notes will be underneath the YouTube video. So if you look underneath the video, you could click on the description, and you can click on expand, and you'll be able to see all of those links. We're also going to have them all on our webpage, twig.org. Thanks, everyone. Oh, I was just about to say thanks for watching and good night. But before you go away, perhaps what a lot of you have been waiting for is Katie's Career Corner. So, Katie, over to you. Tell us about careers in the global health space.
That's sort of like a drum roll, or like introducing someone in a show. Should try that more often. Anyways, yes, for Katie's Career Corner today, I have 2 job postings. The first one is the Change Center for Health and Gender Equity that Jessica mentioned. They are looking for a communications associate. This role entails managing and building their social media presence, website management, etc. Candidate is asked to have a bachelor's degree in communications, journalism, or a relevant field, 1 to 3 years experience in communications and public relations, and Hale or nonprofit experience is helpful. That'll be on our website and in our show notes, so you can apply. The second one is AMREF. AMREF is looking for a country director. With all the responsibilities that entails, requirements are a postgraduate qualification, preferably in public health or related field, 7 years experience overall, and 3 in a senior management position, proven people management skills in a multicultural environment, excellent English language communication skills, etc., etc. It did not say where the country, what country you would be directing, but the information for the job will be on our website and in our show notes.
Okay, yeah, I was also interested in the fact that they didn't mention what country they were talking about.
I looked for it like really often, and I was like, "There's got to be hidden here somewhere." No, so maybe you can.
Well, we can be sure that it's an English-speaking country, because they want you to have strong English. Okay, so links to those jobs are going to be on our webpage. They'll be in the show notes, so check that out if you're looking for work in the global health space. As always, we have that every week, so keep an eye on our webpage, and you'll see that's updated. We've got a Katie's Careers Corner section on the webpage. Other little things, you can always get in touch with us on Twitter. We've got the hashtag TWIG, and you can get us at @TWIG team. You can get any of the team members; they're all on Twitter. You can get us by emailing us at hello.twig.org, hello@twig.org. I'm unable to speak today.
We've all caught something.
Common issue. It's the common issue for all of us right now.
Yeah. It's not, you're not the only one. I think I was like, oh my god, what's happening to me? So.
Oh, well, anyway, thanks for watching. If you've been watching this on YouTube, same time, same place next week. Don't ever change, don't do drugs, always do your best. If you're watching this live, don't go away. We're going to have a discussion section, and the live audience can stay with us. Send us your questions, etc., over the Twitterverse. Okay, thanks very much, everyone. Cheers.